you.
Awesome. So thank you all for the invitation to present my research. Some of the findings that I'll present, well, all of the findings I'll present are from the Women's Circle of Health study. Um, I also want to mention that I'm no longer at Rutgers University. I'm now at the Mailman School of Public Health at Columbia. Okay, there's a delay. There we go. As Dr. White eloquently presented shortly ago, there's emerging evidence that shows first that there's a greater prevalence of use and earlier initiation of use of personal care products, particularly hair products among Black women compared to their white counterparts. So this is thought to contribute to an unequal burden of exposures to endocrine disrupting chemicals, as well as other potentially harmful chemicals, including carcinogens and mutagens. And with a focus on hair products specifically, hair dyes and chemical relaxers and straightening products, there are noted differences in the prevalence of use. So white women tend to use permanent hair dyes at a much higher rate than Black women, while Black women use chemical relaxers and straightening products substantially more than white women and other racial and ethnic groups. There's also evidence that there's variation in chemical relaxer use across Black populations. For example, the prevalence of use of relaxers is reported to be around 90% or higher among Black women in the US and in Ghana, while countries in East Africa, including Kenya, the prevalence is only about 59 to 60%. As noted earlier, a lot of the prior analysis of the association between hair product use, namely hair dye use, has been conducted in historically white populations, and Black women tend to be underrepresented in many of these epidemiologic studies. And so our analysis of the Women's Circle of Health study data really were among the earliest evidence for a relationship between hair dye use and breast cancer risk in Black women. So I just wanted to highlight some of the endocrine disrupting chemicals typically found in hair products and personal care products that are known to interfere with the normal functioning of the endocrine system, and that can act directly on hormone receptors in the breast and mimic or antagonize the receptors. So a recent review of endocrine disrupting chemicals in these products summarized the mechanisms that estrogens, phthalates, and parabens might participate in the context of carcinogenesis. So estrogens are added to hair products to promote hair growth, and experimental and animal studies suggest that they promote epigenetic changes that lead to the predisposition of cells to tumorigenesis. Also, they can lead to altered mammary gland development and promote cellular proliferation. And phthalates are added to hair products for fragrance or a certain smell in hair products so that they smell better. And they're known to alter mammary gland development also through epigenetic changes. They can also promote cellular growth and increase the migratory and invasive properties of breast cancer cells. And parabens are used as preservatives. And they're added to products to elongate the shelf life, and they're known to induce the growth of epithelial cells in the breast. They can also increase the migratory and invasive properties of breast cancer cells. So if we just consider these three endocrine disrupting chemical groups and their uses in hair care products, we can see that, and other personal care products, we can see that there are clear mechanisms that might contribute to their exposures and how these exposures might impact the etiology of breast cancer specifically. So a growing body of evidence suggests that endocrine disrupting chemicals can act on human breast cells through a variety of genomic and non-genomic mechanisms. such as those that I mentioned in the last slide. And these mechanisms enable the hallmarks of cancer, especially the ability for a normal cell to transform into a cancer cell and to grow uncontrollably. In a recent population-based study of women in Ghana, focusing on postmenopausal women, the investigators actually showed that the use of relaxers, so chemical relaxer products, especially lye-based products, were associated with altered estrogen metabolism. So among those reporting using those products, they had increased rates or higher levels of estrogen metabolites in their serum, which suggests altered estrogen metabolism. And this altered metabolism would be an important contributor to breast cancer risk and the risk of other hormone-mediated cancers. So long-term as well as short-term studies are really needed to improve our current understanding of the impacts of EDCs and other carcinogenic compounds on breast cells. So a major focus of my lab is to understand factors associated with the earlier age of breast cancer diagnosis and greater prevalence of more aggressive tumors, specifically among Black women. And one hypothesis, and the hypothesis that really underlies the work that I'll present shortly, is that early exposures to endocrine disrupting chemicals and other harmful toxic chemicals in hair products and other personal care products might contribute to the inequities we see in terms of breast cancer. And so we examined the relationship between hair product use and breast cancer risk in the Women's Circle of Health study. And there were three main objectives of our analysis. The first was to examine the prevalence and patterns of hair product use among Women's Circle of Health study participants, and we focused on permanent hair dyes, chemical relaxers or straightening products, and deep conditioners that contain placenta or cholesterol. The second objective was to assess the associations of the use of these hair products with breast cancer risk. And lastly, we wanted to assess the associations of certain characteristics of product use with more aggressive tumor features. So the Women's Circle of Health study started as a case control study in New York City, so the 5 boroughs of New York City and 10 counties of New Jersey that have the largest population of Black and African American women. The study enrolled about 2,300 women with a primary invasive breast cancer. A little over 1,500 of them were Black or African American, and 772 of them were white. And we also enrolled about 2,000 cancer-free control participants who served as the referent group. So about 1,300 of these controls were Black or African American, and 715 were white. In terms of data collection and data analysis, all of our data collection occurred through in-person interviews, and our field interviewers also collected anthropometric and body composition measurements using standard protocols. And specific to the hair product use questions, again, we focused only on permanent hair dyes, so we didn't ask any questions about semi-permanent dyes or natural dyeing agents. We focus on chemical relaxers and straighteners, and the caveat being, given when we launched this study, what I can say is that the use of keratin straightening products and other non-relaxer-based products, we didn't consider those. So we were really just asking about lye-based and non-lye-based chemical relaxers, so the traditional relaxers. And we also assessed the use of cholesterol or placenta-containing deep conditioning products. So these were typically products that women put onto their hair and then rinsed off. So these questions were ascertained in a baseline interview, and we also collected pathology records, and we used the pathology records to examine breast tumor characteristics. We ran a series of logistic regression models to assess the associations of interest, and we controlled for important breast cancer risk factors and confounders. So on this slide, I just want to just articulate or reiterate that there's substantial variation in the prevalence of hair product use by race. So as you can see in the graph, permanent hair dye use was more, well, in our study, and I'll also mention that the graph focuses on women without cancer. So in that referent group, white women reported hair dye use at a higher frequency than Black women. So among white women, the prevalence was 58% compared to 30% in Black women. And for chemical relaxers, 88% of Black women compared to 5% of white women reported chemical relaxer use. As far as deep conditioning products, we found that 59% of Black women compared to 6% of white women reported using those products. And the remaining slides will focus on associations with hair dyes and relaxers, because overall we found no significant relationships between the use of, or patterns of use of deep conditioning products with breast cancer. So I'll just focus on hair dyes and relaxers. So in this first table, I'm just highlighting two key findings. The first was that so let me just back up a second. This slide also is stratified by race. So I'll talk through the findings for Black women, and then I'll mention, the findings for white women. So we found that while a history of regular hair dye use versus non-use was not statistically significant in terms of the association with breast cancer in Black women, we did find that among Black women reporting the use of darker shades of dye, that their risk was about 51% higher than those reporting no use. So that's the first, the first pink bar that I'm highlighting. And you can see when we look at the group of white women, there is no statistically significant relationship. Although the odds ratio is higher than 1, the confidence intervals indicate that that relationship was not significant. We also found that among Black women, salon application of hair dyes was associated with about 26% increased risk of breast cancer relative to non-use. And again, when we look at this association in white women, there was no significant association. I'll also mention that home kit, so the application of hair dyes using home kits was not significantly associated in either group. And those reporting combination application or having a history of both salon application of hair dye and home kit also was not significantly associated with an increased risk. In this table, I'm showing the relationships between hair dye use and breast cancer risk, stratified by estrogen receptor status and triple negative subtype. And this is just in Black women. So again, we're seeing this significant association between the use of darker hair dye shades with the risk of ER positive tumors. So the tumors that are expressing the estrogen receptor, there is this association with darker shades of dye. There appears to be also this increased risk for ER negative tumors and triple negative subtype as well, but those two risk estimates did not reach statistical significance. And also we see, a consistent relationship for salon application of hair dye, suggesting that dyes used in hair salons may be associated with breast cancer risk, sort of differently than home kit for whatever reason. And that, I think, is something that needs to be explored further. So in this table, I'm showing the associations between hair dye use and breast cancer risk by estrogen receptor status and triple negative subtype among white women. And again, we're seeing this consistent relationship between darker shades of dye. So among white women, we also see that for those reporting the use of darker hair dye shades relative to non-use, there was a 54% increased risk of estrogen receptor positive tumors. And this table is showing data for the associations between chemical relaxer and straightener use with breast cancer risk, again, stratified by race. And what was really interesting, and contrary to what we hypothesized, was that there was no significant relationship between regular chemical relaxer use and breast cancer risk among Black women. But I'll point out that the majority of our study sample reported using these products. So there really was very little variation in use. Conversely, we see about 74% increased risk of breast cancer among white women reporting the use of these products. And here we see that for home kit application of chemical relaxers was associated with almost threefold, so a little more than 2.5 times risk of breast cancer. And we investigated the relationship for dual use. So among women who used both hair dyes and chemical relaxers, there was also a more than twofold increased risk of breast cancer risk. And these findings were really only observed among Black women. I'm sorry, only observed among white women. So in our subsequent analysis, we focused only on the Women's Circle of Health study participants with breast cancer, and there were about 3,000 of them. And we wanted to really go a little more in depth and examine the associations between specific characteristics of hair dye and chemical relaxer use with breast tumor features. We were interested in knowing whether things like the years of use or earlier use, specifically use before age 12, and application type were associated with more aggressive tumor features, including higher tumor grade, larger tumor size, and triple negative subtype. And that's because these more aggressive tumor features are associated or indicative of poor survival, especially in Black women. So some of the key findings from these analyses were that women reporting combination application of hair dyes. So again, these are women who reported that they had their hair dyed in a salon, but that they also dyed their hair themselves at home. So combination application was associated with more than twofold increased odds of higher tumor grade. Combination application of chemical relaxers was associated with almost twofold increased odds of larger tumors. So the one thing about combination application, well, first, that was a novel finding, but we hypothesized that women who report using or having a history of combination application, that might indicate a greater exposure intensity, probably because they're probably using these products more frequently than recommended. But again, this is something that we would need to really look more in depth at. We also observed evidence that longer duration of use. So use of chemical relaxers for more than 10 years, as well as earlier use, was associated with larger tumors. And these are, again, findings that we really need to explore further to really understand the implications. So I just want to summarize the key takeaways. First, we need more research, and I'll keep reiterating that we need more research to really better clarify exposures to the the chemicals in these hair products, as well as other personal care products, and how they might be associated with elevated risks of breast cancer and other cancers. Um, so for endocrine disrupting chemicals, even at low concentrations, they're known to perturb the endocrine system, and long-term exposures can have a variety of adverse consequences. I've focused here on breast cancer, but there are other conditions such as fibroids and maternal and child health outcomes that impact Black women, you know, at disproportionate rates that we should really be understanding the relationships between these exposures. Timing, dose, duration, and the age at exposure are also important factors, and really drilling down to some of these, the way we measure some of these exposures is critical to understanding their impacts on health. And again, more research is needed. We focused, so this symposium is really focusing on exposures to toxic chemicals and personal care products, hair products, nail products, but there are additional sources to these chemicals that we also should be considering. And also exposures to mixtures of chemicals, which I didn't discuss at all today. I'll end with some public health implications, so more studies, more research, more granular methods of exposure assessment. I also think that it's critical to engage consumers and salon workers and provide them with adequate resources to help them make safer, cleaner product choices. That would be really important to helping to mitigate some of these exposures, and also understanding the potential harm associated with the use of certain chemicals found in certain products. And lastly, advocating for policy change is another strategy to ensure the removal of toxic chemicals from consumer products. So I just have this, this table down at the bottom that shows that there are standards for a variety of products when it comes to regulation and toxic chemical regulation. But when it comes to cosmetics, there's virtually no standards. And that's taken from the Environmental Working Group. I also highlight Not So Pretty and Toxic Beauty because I think, as more research emerges and the public are aware of some of these concerns, they're also becoming more aware and interested in learning how they can protect themselves and their family's health. And okay, so this really is my last slide, I think. I just wanted to highlight some resources and education about chemicals and personal care products. And these are sources that will contribute to increasing the awareness among consumers and salon workers about environmental chemicals and toxic chemicals and how they might relate to health. So the Breast Cancer and Environment Research Program, BCERP, is a good source of emerging data and information from research about these exposures and how they relate to breast cancer. The Environmental Working Group and Silent Spring both have smartphone apps that allow consumers to scan products and just get really useful information about hazards and chemicals. And then Clearia is an online shopping tool that allows you to check if the listed ingredients in any of your personal care products are considered a chemical or substance of concern. And I think, again, these resources can really help consumers potentially become more educated about chemicals in these personal care products and how they might be associated with health risks and might help facilitate the selection of safer, cleaner products. I'll end here with my acknowledgements. So we've been funded by the National Cancer Institute and a few other sources, and these are my collaborators, investigators, and this work wouldn't be possible without the Women's Circle of Health study participants, our research staff and students. And finally, here is my contact information. I look forward to questions and discussion. So thank you.